One of the most controversial parts of President Obama's health care reform plan went into effect this morning. Insurance companies are now required to provide contraceptives to women at no cost. As News 3's Sergio Avila shows us, it's not just about birth control. These changes have opened the door for more women to have better access to care.
Good. Sounds like you eat your vegetables.
Dr. Dahlia Wax says she's seen copays and deductibles keep women from getting checked out. The changes that just went into effect change all of that.
What happens today allows insurance to not cause copays or deductibles to be obstacles for women getting this addressed.
Annette Ravenel of the Affordable Care Act support group known as Know Your Care says copays and deductibles left many women with a choice.
So that would mean that a lot of women would not go get a lot of the preventative services that obviously help and save lives.
The changes cover things like STD checks, breastfeeding support and supplies, and contraceptives with proven health benefits. Republicans say the changes are an attack on religious freedom. Churches are exempt, although religious-affiliated hospitals and schools are not. Dr. Wax says it's truly about seeing and educating more women in her office.
If patients feel like they don't have to come out of pocket extra, especially for birth control, maybe they'd be more willing to get those services and be checked out.
More than 300,000 women in Nevada are eligible to take advantage of the changes. But Dr. Wax has her concerns. She's seen insurance companies start to cut other coverages to make up for the new requirements.
Even though on the outset this looks like a win, and I believe it is because we're going to have more people have access, we are starting to see a lot of criticism on less of the next step being covered.
That means a mammogram is covered, but insurance companies may not cover as much of the biopsy that might be required after. Wax says they're watching that aspect very carefully, but it's still too early to really tell how things are going to change. Sergio Avila, News 3.
And just to be clear here, these changes are for women who have health insurance. Although the rule goes into effect today, some insurance plans won't include the changes until next year or even 2014. It's best to consult your insurance provider to find out when you will be covered.